Assalamu alaikum, dear class. This is second lecture online on Thursday, and we are discussing parameters of identity. So far, two important parameters have been discussed. Number one, age, and number two, sex. Today I will discuss other four parameters: stature, religion, race, congenital features. It includes few more, but today I will take up anthropometry only. Dactylography and other features, congenital features, will be discussed in next lecture. So what is stature of a person? That is height. It's an important character and provides assessment in identification of human remains. So again, this is very important parameter when only skeleton is available or some bones are there. So there are three methods by which we can determine stature. Number one, if complete skeleton available. Number two, if complete skeleton not available. Number three, from long bones. So these are three parameters or three methods from where you can study stature of a skeleton. Number one, if complete skeleton is available. Now, how can you determine stature? That there is a formula which says stature is equal to length of skeleton plus 2.5 centimeter for soft body parts. So you have to measure length of skeleton first, then you add 2.5 centimeter for soft tissue or soft body parts, then you will get stature. Number two, method number two, if complete skeleton not available. Sometimes complete skeleton is not found and body is cut into pieces. So what will you do? So if you get outstretched arms, if you get arms only, then you can find stature by this formula: length between tips of both middle fingers with fully stretched arms will give you stature. Now in second scenario, you only have upper body skeleton. So length from vertex of skull to the top of pubic symphysis multiplied by 2 is equal to stature. So you will measure the length from vertex to pubic symphysis and multiply by 2, that will give you stature. Number three, length from heel to top of pubic symphysis. This is the case when there is a lower skeleton only, no upper skeleton is present. So you only have legs. So what will you do? You will measure length of that skeleton from heel to top of pubic symphysis and multiply it by 2 and will get stature of that person. Number 4 situation or scenario or formula. If you have sternum, if you have one arm and you have sternum and clavicles, then stature will be length of one arm multiplied by 2 plus 34 centimeter. Add 34 centimeter for sternum and 2 clavicles. So that will give you stature of that person. So third method to determine stature from long bones. If you only get long bones and police has brought you long bones and you are asked to determine stature, then what will you do? Then you will determine stature by applying this formula, that is length of long bone, multiply it by a multiplying factor which is different for different bones. So if you get humerus, that is about 20% of body stature. So you know this 20% is the multiplying factor for humerus. Similarly, femur has 27%. Femur is equal to 27% of body stature. So that is the multiplying factor for femur. 22% is for tibia and 35% is for spine. So in this way, if you have either of these bones, long bones like humerus, femur, tibia, spine, you can calculate stature of that person. That was about stature. Next parameter is religion. Now this is very clear and simple, but you can differentiate, or we can differentiate people on the basis of their religious belief and affiliation. If they follow religion in their dress code, in their ethics, in their behavior, externally and internally, then we will see those changes which are obvious, visible signs which can be found in those persons. Like Muslims, in Muslims you can see if they are performing 5 times salah, they will have some mark on their forehead, and they can have something on their ankles, some mark, some thickness. In Christians, those practicing Christians, you can see cross and some other signs. Similarly, in Jews, you can see beard as well as a typical cap they wear. And in Hindus, they also mostly they shave their heads, or their women use tilak, and so some other features they have. So on the basis of religion, we can have some identification of that person, to what religion he may be. A Muslim, he may be a Christian or Jew or Hindu or Buddhist or someone else. Parameter number 5 after religion is race. So race, when race becomes important as parameter, when there is unclaimed dead body is found, So this may happen in air crashes, because so many people of different races, they travel by air, by sea, by railway, and so visiting different countries and different parts of the world away from their homeland. So in those cases, those people are to be identified in a mass disaster like this. So race can be determined from two methods, like from general appearance of that person, if dead body is intact with soft tissue, and other is if bones are there, only bones are there and there is no soft tissue. So there are different ways to determine race. Coming to a body which has soft tissue, which has facial features, so here you can study that the race, determine race from under these headings. Number one, general appearance of that person includes examination of clothes, what type of clothes he or she is wearing may be peculiar to that race. Complexion, sometime white race is generally white, black Negroes are black. Hair color, style may be different from race to race. Lips, eyes and teeth. Coming again to clothes, Pakistani dress is shalwar kameez mostly, but there are other dresses too. Indian dress may be dhoti and sari, the person wearing. Western dress may be shirt, skirt, frock, now which is very common in our Asians too. Complexion. So Pakistani and Indian or Asians are brownish in color, generally ranging from white to black, but not pure white or pure black. Now Negroes and South Indian, they are black in color. Europeans are generally white and fair color. Coming to hairs, Pakistani and Indian people, their hair are black, long and fine. In Chinese and Japanese race, the hair is black, long, thick. In Negroes, hair may be short and curly, mostly curly, not straight. In Europeans or white race, you can say brown or reddish or golden. Blonde. So hair is short and fine. Now studying lips, in Negroes they are thick and everted. In Europeans they are mainly thin and mainly inverted. So that was about general appearance, race from general appearance. Now I come to how to determine race from bones. When skeleton, only skeleton is there. So following bones help: skull, mandible, teeth and limb bones. So skull is most important. So certain differences exist between the Negroes, Caucasians and Mongols. So who are Negroes? They are black mostly in America, Europe and some other places. Caucasians are mainly Europeans, and Mongols are in Mongolia and China, in these areas, Tibet. So there is a term or a formula which is called cephalic index of skull. This is obtained by multiplying maximum transverse breadth of skull by 100 and dividing it by maximum anteroposterior length of skull. So I repeat again, you get the maximum transverse breadth of skull, multiply it by 100 and divide it by maximum length, anteroposterior length of skull. So where you can find breadth of skull is the greatest diameter across the skull above the mastoid process. So that is the anatomical landmark where you can get maximum breadth. And how length of skull is measured? It is between the glabellas and the external occipital protuberance. So distance between glabella and the external occipital protuberance will give you length of the skull. Now based on this formula, skull, people with peculiar skull or different type of skull can be categorized into three categories or groups. Number one, dolichocephalic. Number two, mesaticephalic. And number three, brachycephalic. So dolichocephalic are those people who have longest skull, long-headed skull. That means their anteroposterior length of skull is maximum. So naturally, if anteroposterior length is more and transverse breadth is less, then cephalic index will be less. So their cephalic index ranges between 70 and 74.9. So example is Negroes and Aryans. Number two category is mesaticephalic. So they are also called medium long-headed. Their cephalic index ranges between 75 and 75.9. So Europeans and Asians other than Mongols can be categorized in this category. Number three or third type of people having most transverse skull is more than length. Those are called brachycephalic or rounded head. So their cephalic index is maximum is 80 and above, and this is Mongols, is seen in Mongols. So on the basis of cephalic index, we can categorize the human race into different groups. Teeth. Now coming to teeth, if you can observe the third molar is bigger than the first two in Negroes only. Generally the molars should be equal, but in Negroes third molar is the biggest. Now in Mongols, upper incisor teeth are shovel shaped. Shovel is an instrument, so they look like shovel. So from limb bones, if you see in Europeans, radius and humerus index, radiohumeral index is below 75 in Europeans, and in blacks it is above 80, and tibiofemoral index in Europeans is below 83 and it is above 83 in blacks. This also gives us some information to determine race. So last feature today, which I will start discussing it, one of it, that is anthropometry. This is congenital features. So what is a congenital feature? That is a feature or trait or characteristic or factor or point which is already present at birth. It has been transferred or inherited from genetic material. So it's genetically it's already present in the person, without any role of environment. So these features, congenital features, provide very important information for identification of a person, and following 4 are given in the book, like anthropometry, number 1, number 2, body prints, most prominent are fingerprints, footprints, lip prints, etc. This study of prints is also called dactylography. That I will take up in the next lecture. Then DNA typing or DNA testing or DNA profile or DNA fingerprinting, all are same thing. This is DNA. Now this is one of the surest method. These are also DNA pattern is also congenitally present in each person. Similarly, fingerprints are present in each person, and congenital malformations. So these are 4 features, congenital features. Today's first feature, congenital feature, and last to be discussed today is anthropometry. What is anthropometry? Anthropos is man and metry is measurement. So anthropometry will become measurement of man. So it deals with measurements of various parts of human body. It was introduced by French criminologist Alphonse Bertillon in 1882. Hence it is called Bertillonage or anthropometry. So this can be an MCQ question: name of the founder or inventor or scientist who organized this study, Bertillon, and maybe year also may be asked. Now the principle on which anthropometry works: it is measurements of various body parts don't change after adult age. They keep on changing, as you know. In period of proliferation of age, from birth onwards, all body parts continue to grow in size, even their shape changes, and their weight density increases, like bones, muscles, blood vessels, everything grows. But after 21 years, the growth stops, and the body parts, they don't change much, they don't alter. Like bones, they remain the same, height remains the same. So no two persons show same measurements in all respects. So identity can only be determined when we know how we can separate a person from other person. What is unique feature of that person which is different from all other. So this is identity. So any method or any study which can help us to identify such characters which differentiate from other humans, which are only specific to that person, then we can determine the identity of that person. So here this anthropometry involves the noting or registration of characteristics under three headings. Number 1, descriptive data. Number 2, body marks. Number 3, body measurements. So what is descriptive data? So this is how a person looks like, what is his color of hair, what is color of skin, what is color of eyes, whether they are brown, black, green, what is the complexion of the person, fair, white, black, brown, lips, what is the shape and size, thickness, thin or thick, big or small, shape of nose and ear and chin, etc. So you can see like chin is triangular in many people, is square in many other people. So descriptive data gives us clues about unique identity of a person. Number 2, body marks. Like on body we can find several marks like moles on body, scar marks, tattoo marks, etc. So as you know, if there is a prominent mole at a prominent place of body, like on face, then it is entered as mark of identity in NIC, National Identity Card. So that may be unique for that person. Scar marks of any disease, then healing takes place, then there are some scars left. Some scars may be of surgery or some other stuff. Tattoo marks are also very gaining popularity and everyone knows about it, what are tattoo marks. So these are body marks which help us to determine identity of a person. Then body measurements. There are about 14 body measurements, like standing height of the person, sitting height, length of the head of the person, breadth of the head, breadth of the face, length of right ear, span of outstretched arms, length of left foot, length of left middle finger and left little finger, left forearm and hand. So mainly length of these parts and height and breadth. So these measurements, body measurements of a person, all of them may not be same. They will be definitely, there will be some difference in any aspect. So that difference will make that person unique. And so a different identity or his or her unique identity can be determined by these body measurements, body marks and description of that person. So this is called anthropometry. Now last slide today is what are drawbacks. There are advantages of this system, anthropometry. Yes, it is helpful in identity, but there are some drawbacks too. The number one and main and big drawback is it is applicable to adults only. You know why? Because in proliferative phase of age, these body parts and body shapes and color keep on changing. Person continues to grow in height and in shape. So how can you fix it? You don't have a fixed data, a constant or permanent data of that person, which you can only get from adults. Number two, second drawback, many errors are introduced due to personal factors. So there is a team of people who is involved in this process. By noting the identity or these features of persons, they can make many mistakes while measuring those body parts, and while entering the data they can commit mistakes. Third drawback is well-trained operators are required, because the team must be expert. Everyone should know his or her work well. Number four drawback is lot of hard work is required. It's kind of manual, tiring, exhaustive job, and requires a lot of hard work and time. So these are some of the drawbacks of anthropometry. With that, I conclude my lecture. Thank you very much. इसका जो